All right, Dr. Rich here. So last denture video, you saw me take this custom tray, border mold it, and take a wash impression. I sent this tray to the dental lab, and they sent me back a master model. So this is the actual stone model that they're going to build the denture on. And then this is a occlusal rim. This is just wax on some base materials, same material that the custom tray was made out of. So this, we're going to adjust the height on and the positioning so the lab will be able to set the teeth on it. So today's visit is going to be a bite registration, so I'll show you how I'm going to do that. Just going to trim this to get it to fit. I'm also going to be using my Willis Bite Gauge. This is a really old one. This is made in the USA. This one probably dates from the 1960s or so. But I'll show you how I use this. And if you want a little bit more in-depth video as to how to use one of these, I'm going to leave a link up on the card. That's right up here. So you can watch that video to see what this does and how I use it to get some more ideas. And so this particular brand's not available anymore. This is made by SS White. SS White's still in business, but doesn't make these. But you can find these on Amazon nowadays pretty cheap. I'll leave a link to it down below. They make more expensive versions if you want to spend a couple $100, but the Amazon ones work fine. All right, let's go to the mouth now. All right, so I got the patient in the chair. He's got his immediate denture in his mouth, and I'm going to measure the distance between the bottom of his chin to the bottom of his nose. And that's the vertical dimension of occlusion I'm going to use to adjust the wax rim. And another way to check to make sure that that's right is just, it should be basically the distance between his lips to the center of his eye. And I'll leave a link to that other video that I made showing how to do that. I go into more depth in that video. Okay, so now that we have that number, I'll write that down. It's 61 millimeters. So now that's going to be my reference point. I'm going to put the occlusal rim, and this is just with the wax the way it came from the lab. As you can see, it's a little bit too tall. It's sticking down too far, so I got to cut some away. Now, this is where having an amazing dental lab makes all the world of difference. Basically, if you have a great dental lab, they're putting the wax where the teeth should be, and a lot of times they can actually make a very decent guess based off of some anatomical landmarks off the cast as to how far the wax should go down. It shouldn't be that far off. There shouldn't be a lot of adjusting you need to do. Granted, sometimes it varies, sometimes it doesn't, but in this situation, I just have to take a little bit more off. Again, I just trim a little bit more off. You can, in this case too, the wax that my lab uses is actually fairly soft, so I just ask the patient to bite down a little bit harder, and I can see the imprint of their teeth, and trim it down, fit the wax rim back in place, and then use the Willis Bite Gauge again to measure. Still got a little bit more to go. I'm just checking to see where exactly I'm going to need to adjust it, and I'm also really happy I'm getting some suction with the wax rim. So at this point too, these trays are usually pretty loose in the person's mouth because the lab makes them so that they don't engage any undercuts on the stone model, but we're getting some decent suction, so that's a good sign. So trimmed it some more, put it back in, asking him to bite, and I think we got it. We're at the right spot. And so I'm using the bite gauge again just to make sure, but I also ask them, how does it feel? How does it feel like your mouth's open too much? Or does it feel comfortable? How's the lip support too? That's what I'm checking now to make sure. Sometimes I gotta add a little bit, sometimes I gotta remove some. He likes it, so next I mark the midline of his face, and then I also mark the width of the nose. This will give the lab information as to where the two front teeth should be meeting, and then also the width of the nose. He gets an idea as to how wide the front 6 teeth are. So basically from canine to canine should follow that arc, and then with that he can pick the appropriate size teeth, appropriate to fit the person. And then I just cut a couple little notches in the back so we can take a bite registration. Pop that back in, double check it one last time with the bite gauge. We're still good. And for bite registrations, I use Blue Mousse super fast. I think it's like a 30-second set. I just squirt it on the occlusals of the teeth, both sides, and I'll just have the person bite together. And I'm going to squirt a little bit more too, where he's missing the teeth in the front, just to connect those two pieces of Blue Mousse on either side. So I just got one arch, one horseshoe shape extrusion of the Blue Mousse rather than two individual ones, because it inevitably pops loose. All right, and we got that. So now that we have we adjusted that, we got the bite registration. Now I just need to take a mold of his lower teeth, and for that I'm just going to use a stock tray. Just trying this in and make sure I got the right size. And for that, and for the impression, I'm going to use some alginate. I typically do 2-3 scoops of alginate powder, fast set of course, with 3 measures of water, and then I mix that in. Just mix it in quick, and then I got to start squeezing it against the side of the rubber mixing bowl so I get all the air bubbles out of the mix, so we got a nice impression. So just keep doing that, mix it all up till we get a nice creamy consistency, and then we pop it into the impression tray. Scoop a little bit at a time. Now I find, so this material is accurate enough for an opposing model, not accurate enough for a cast of, although I do know some dentists that will use alginate while they take impressions for partial dentures. I typically don't. Set up, and there we have it. Now it's ready to go to the lab. All right, and in the next video, it's going to be the wax try-in visit, so you can see what the teeth look like. Thanks so much for watching. See you in the next one.